from all those who will be joining us on our various social media platform. That's Facebook and
Warm welcome to those of you who are joining us wherever you may be. I'm Reda Setki from the Geneva Learning Foundation from Geneva, Switzerland. We are now live across all of the main social media platforms. So whether you're watching us on LinkedIn, on YouTube, Twitter, or Facebook, you're all very welcome. What are we going to be talking about? First of all, wrapping up the 2020 activities of the COVID-19 Peer Hub, updating you on the peer learning exercise, what we learned about how immunization staff has successfully moved individuals and groups from hesitancy to acceptance of vaccines. And of course, this is especially relevant at a time when the countries all over the world are getting ready or are already in the process of introducing the COVID-19 vaccine. We'll also update you the first preliminary results from the COVID-19 Peer Hub Pulse. So this is a survey questionnaire really trying to get at what's happening with COVID, where you work. And we need some help there. I'm going to tell you about why. And then most important, at the core of today's session, today's live stream is going to be Teach to Reach. We're at D-22. So we're 22 days away from this conference that will be gathering participants from all over the world. We already have a lot of people, a lot of people registered. There are a few seats left, so I'm going to tell you in this live stream exactly how to register, and you'll be hearing firsthand from COVID-19 Peer Hub members, as well as members of the organizing committee, from members from 35 different countries, many of whom are here in the room. We'll tell you about why this conference, this Teach to Reach conference matters, and what is the ultimate challenge, why COVID-19 vaccine introduction in many ways is such an important challenge. We'll see you. Many of you are already sending your greetings. Thank you. I'll be sharing them at the beginning of the live stream. I just want to acknowledge Sia, Boraya, Tahir, Subhendu, Tanushri, Amel, Koyoro, Abubakar, Ramzi, and many more. Thank you so much for being with us. Warm greetings and Happy New Year. Wishing everyone in the COVID-19 Peer Hub, immunization staff all over the world, Warmest wishes from Geneva, Switzerland. I'm Reda Satki of the Geneva Learning Foundation. We are live streaming this session. This is a special session. We just wrapped up mid-December what we call the COVID-19 Peer Hub for 2020. And we have a lot to share, kicking off the year early and really jump-starting the year, as we know that 2020 may have been the year of COVID, but of the pandemic. But 2021 may well turn out to be the year of vaccination, where people who deliver vaccines matter more than ever. Welcome to you, whether you're joining us from LinkedIn, YouTube, Twitter, or Facebook. Just look for the Geneva Learning Foundation. You will find us across all those platforms. Hello, Charlotte. How are you doing? How are you feeling?
Hi, Reda. I'm doing great. I'm really excited to be back with the Peer Hub community after a 2-week break.
Wonderful. Yes, yes, indeed. So let's start with some of your messages. So we're going to be just a quick overview for those of you who are just joining the live stream or just joining us in Zoom now. We're going to wrap up exercise 2 from hesitancy to acceptance. I'll update you about certification, tell you what we learned from the more than 700 case studies documenting how immunization staff move people from hesitancy to acceptance of vaccines. I'll update you on first, what we're learning from the Peer Hub COVID-19 Pulse and tell you all about that. And then the main feast will be really what you need to know and what you will gain from this Teach to Reach Accelerator Conference. And most important, how to make sure that you get a seat at this conference and that you don't miss this. So before I go any further, I want to greet many of our regular participants on the live stream on Facebook. Amel El Tahir, welcome. Koyoro Seni, so Charlotte, okay. Koyoro Seni Charlotte. I thought she was saying hello, Charlotte, but that is part of her name. Our very own Dr. Tanushri Mandal, who says, good morning, afternoon, evening, Happy New Year. Yes, Happy New Year back to you, dear Tanushri. Let's embrace this new year with new hopes. Ramzi, from Tunisia, hello back to you. Happy New Year as well. Abu Bakr Mohammed says, good evening, everyone. I'm happy to see this happening. Calling in from Nigeria, Gombe State. Koyoro says in French, congratulations to the team. Congratulations to you. Thank you, Amel El Tahir, for your good wishes from Pakistan. Yes, we're excited too for more news about the upcoming conference. And Tanushri is a member of the organizing committee that is putting this conference together. Subhendu Kumar Ray from India. Yes, well, okay. I'm assuming you're also telling us hello, but we thank you for sharing. Tahir Abu Bakr, excited to hear from all, excited to be here. And of course, we'll be turning to you as well to tell us more. I'm going to stop here right now. There are many more greetings because I want to turn to Charlotte to deliver our wishes for the new year. Charlotte? Oh, okay. And we're going to get to see Charlotte on screen as well. Yes. So on behalf of our team, on behalf of the Geneva Learning Foundation as well, Charlotte is going to share our good wishes for 2021.
Thank you very much, Reda. And it's really a pleasure for me to be participating in the Peer Hub this afternoon, and also to present the New Year wishes of the Geneva Learning Foundation to our very dear COVID-19 Peer Hub members, and also to all those who are following us on our various social media platforms. So warmest wishes for 2021 from the Geneva Learning Foundation. Like a dry leaf that falls on the ground and is tossed by the winds, 2020 came and went with its pains, sorrows, and challenges, but also with the joys, the hopes, and the victories. Talking of challenges, we were faced with the unprecedented COVID-19 pandemic. This global challenge that affected significantly immunization services gave birth to the COVID-19 Peer Hub, this global community of immunization professionals that has grown to become a family. Our family. We celebrate the work that you have done and the work you're continuing to do. We celebrate your contribution to ensure that the health situation of our communities is not compounded while we fight COVID-19 by ensuring the continuity of immunization services. We also take this opportunity to hail all the healthcare professionals that are still at the forefront of the response to the pandemic. I'm talking about those who are at the bedsides of patients, those who are laying down their lives that others will rise up from their sick beds. We also, as we sail through this new year, 2021, we, the Geneva Learning Foundation, we want to wish you more courage to continue to face this challenge, even as immunization takes center stage in the response. It is our hope that as a community, we will continue to work together until the day it shall be certified that we have had victory over the COVID-19 pandemic. As a learning community, we wish you the best in every activity, in every exercise and course you will take part in as a member of the peer hub or a member of the scholar community. Once again, receive the warmest regards for 2021 from the Geneva Learning Foundation. Thank you very much, Reda. Over.
Thank you very much indeed, Charlotte. All right. I want to send out some more greetings before we get into the specifics of the Teach to Reach conference. There's so many of you online who are sending your good wishes. I'm not going to be able to honor everyone. I will try to do a few. So Rajat Garg says, hello, everyone. Tanushri says, congratulations for successful registration of participants. Tanushri, you and the other members of the organizing committee are the ones we should congratulate. Subhendu Ray says, Happy New Year to all. So does Sohini say now. Our very own Alain Blestat Sinku is here. Happy New Year to you, my friend. Beyanwu Peters from Liberia. Atahir Kiyota Abubakar. And many more. I'm going to stop here for now because we have a lot of really exciting news to share with you. For those of you who are joining us on the live stream for the first time, check out, whether you're on LinkedIn, Facebook, YouTube, wherever, you will find a number of resources that were done towards the tail end of the COVID-19 Peer Hub last year in December. So there was the workshop with Susan McKay from Gavi, really talking about Gavi's perspective on vaccine hesitancy and demand promotion. Then there's the workshop with Dr. Anne Lindstrand. You will find that on our social media platforms as well. You can listen and learn from the doctor who is leading for WHO the introduction of COVID-19 vaccines worldwide, and then the workshop with Professor Heidi Larson, one of the preeminent specialists on the question of vaccine confidence and demand promotion. They came not only to teach, but also to learn from you, immunization practitioners. These events you will find across our LinkedIn, YouTube, Twitter, and Facebook platforms. So that's it for the intro. Now, let's dive in. And as you know, we first want to bring to a close, bring some closure for the hundreds of people from all over the world who developed case studies on vaccine hesitancy. And I have one number I'm going to share with you and one piece of information in case you're wondering when exactly we were going to honor the work, the effort, and recognize it with the commencement ceremony in which we'll be delivering awarding certificates to successful completers of this exercise. So there are 322 anglophones and 387 francophones who developed detailed peer-reviewed case studies, and this is the number of people who did honored their commitment to peer review. And at the Teach to Reach conference, you will see that all roads lead to Teach to Reach. On the 26th of January, we'll be holding the commencement events, or two events, one in French, one in English, during which we will recognize and honor the people who develop these case studies. And we hope that we'll be able to share some of the insights, some of what we learned about vaccine hesitancy, working with Heidi Larson and her team and her researchers, working with other partners who have an active interest in this, to how to distill down this massive body of knowledge to make it knowledge that you can use in your work. So I'd like to ask you for a round of applause for participants in the Peer Hub who actually fully participated in exercise 2 and managed to complete, in many cases under difficult circumstances, the full exercise. So exercise 2. Now, second on the agenda is the pulse survey of the Peer Hub. So what is this? So if you don't know about this yet, and you were in the Peer Hub, it's even more important, in part because we want to recognize who actually was a member in the Peer Hub in 2020. So a large number of people were accepted, hundreds participated in the peer learning exercises, and then there was a larger number of people who kind of came and went and did some things but not others. And we want to recognize their participation as well. So all you need to do is go to this page. It's COVID Pulse on learning.foundation if you haven't done this yet. And if you have, we want you to use these buttons. Most people will share via WhatsApp, but you can use all these other platforms. And if you don't see the platform that you want to use to share, you just click on the plus and get more options like Twitter. So that's if you've already done it. If you haven't done it, how do you take this survey and what's the point? Why is it important? So first of all, just put in your name. Don't put in my name. I'm going to put in a dummy email address here. And you share your details to take the pulse. I'm actually going to take you. I think I may have some personal emails that have come in. But so then here you receive this email. Here. Okay. And this email is called Invitation for Your Name to take the COVID-19 pulse. And so really what the point is by taking this survey, it'll give you a sense of, are you actually ready when your Ministry of Health or your employer is going to send out the email or the announcement or convene the staff meeting to say, we're going to be working on vaccine introduction for COVID-19 to protect individuals from COVID-19. We're going to start with the most exposed and most vulnerable. Are you going to be ready? So taking the pulse is one of the things that you can do. Now, one of the ways you can help us, we're trying to build a picture country by country. What is the situation? What is with COVID-19? Now, when you click here, you'll get taken to so you can see this is personalized. So you can't just share this link with anybody else. You just send them to the page where, okay, I've lost the page now, but the COVID-19 Pulse page. And if you click on I am ready to contribute, yes, there are many questions. Some you can opt out, but those questions are going to help us. And really the intent is to help us build a picture. So first of all, I'd like to recognize the fact that there's already almost 1,500. We're getting pretty close. You can see anglophones there are outdoing the francophones. We've got 1,455 respondents, and that's respectable. But here's the thing. Here's the problem. The problem is that in some countries, there's like one person. And it can be somebody from a district, from a health facility, and thank them for having answered. But we need, if we want to build a credible picture of what is going on countrywide, we need you, if you haven't already done so, take the pulse. And if you have done so, talk to your colleagues, by hook or crook, figure out how to show them that this COVID-19 vaccine introduction is actually a real opportunity for immunization professionals who want to, make a contribution, but also to progress in their career. This is what many immunization professionals are going to be doing in 2021. This is what many ministries of health are going to be focused on. So taking this survey can actually help you get ready on an individual level and will help the global partners, the country partners, get a more accurate picture of what is actually the situation. So that's what I would like to share here to give you a sense, and this is a kind of teaser. These are just the preliminary results from the Pulse survey. So one of the questions in the survey is, what's the biggest challenge that you are currently facing? So we're going to do this. There were 9 items, not 10. Otherwise, it would have been a top 10 countdown. Starting from the smallest challenge or the least significant challenge. Let's see if we can cue up some suspenseful music here. I'm going to give you the top 9 countdown. Before I do that, I want to acknowledge Nkechi Ume, who says Happy New Year to all. Yin Yin Hete, who says the same. Abu Bakr Mohammed says, so help us God, assuming you're referring to the introduction of COVID vaccine. Abu Bakr Bungudu, who just says thanks. Do introduce yourself. Tell us what city and country you are connecting from. Mohammed Noor Alio, who says hello everyone. Subhadeep, who says, Happy New Year to all learners. And Subhadeep is waiting for the conference to start on the 26th. Thank you, Subhadeep, as a member of the organizing committee. We have a lot to do and a lot to prepare, but a real opportunity for all involved. Anita Bargava also says, Happy New Year. Dr. Koyan Ebikapye says, greetings to everyone. Amanda Brundi, please tell us what city and country you're from. That's so much nicer when we know where you are actually calling from. So, the top 10 challenges, or top 9, sorry. All right. Challenge 9, health workers may not know which vaccines to give to a child according to the national immunization schedule. So that was the last item that fewer of you chose than any other, but a very significant one nonetheless. Shortage of qualified health workers for immunization services due to COVID-19 deployment. It's surprising to see this at number 8. Higher means less of a priority from the perspective of the respondents. As WHO says, there's actually 200,000 health workers or staff, people, human capacity missing in order to successfully deliver COVID-19 vaccines. Number 7, it's around vaccination campaigns and SIAs. Number 6, the shortages of vaccines or injection supplies due to supply chain disruptions, vaccine shipment, and so on. It's also surprising to see that number 6. We know about the cold chain issues with some of the vaccines, and so on. Health workers concerned about their own safety. That's number 5. Caregivers reluctant to come to health facilities. That's number 4. New vaccine introduction. Number 3. Number 2 is inadequate communication or community engagement to generate demand for vaccination. And the top reason, again, the question was, what's the biggest challenge you're currently facing? And most of you overwhelmingly, preponderantly answered that it's the lack of confidence in vaccination by the community. Now, next up is Teach to Reach. Before I go there, I want to mark a pause and ask the members of the COVID-19 Peer Hub and members of the Teach to Reach organizing committee that are both in the Zoom room with me, some of whom are also following online as well on the social media platforms. If you'd like to raise your hand, if you'd like to respond to any of what I've shown and shared so far, share your story. What happened in 2020? How was the Peer Hub participation? How was the Teach to Reach program useful to you? Why? What did you gain by participating? What are you feeling in the new year? And if you'd just like to wish Happy New Year to participants in the Peer Hub, and those of us who are, and other immunization professionals who are watching and listening online, you're welcome to do so. Let's start with Emmanuel Odu, and then we'll go to Giorgio Milios. Emmanuel?
Hello. Happy New Year to all participants. This is Emmanuel Musa from Kaduna, Nigeria.
Welcome, Emmanuel. Happy New Year to you as well.
Yeah, I actually want to welcome everyone, most especially bless Alan Tinku, who has going to be part of us, and then with all other participants. 2020 had been a very remarkable year for all learners, most especially those that had actually participated in the Teach to Reach, and then with the Peer Hub cohorts. And we've actually learned so much on the issue of how to develop ourselves as professionals on immunization field, and then how to support, most especially the pandemic, that is the pandemic, and how to support those activities in our various countries at various levels. Now we're able to bring out a lot of ideas through the through the Learning Foundation, and then we're able to garner a lot with projects and with case studies where we knew that actually it's not all well for us, but then definitely there's a quality time for us to keep improving on those projects. And then I'm sure as professionals we're equally ready. Then we have the challenge of now coming out on the issue of vaccine hesitancy, and which the number one based on the countdown, that the first number happened to be a very, very issue if we can look just between December to now that the introduction of vaccine just came up. we know as professionals, we're going to have a lot of serious issues to dwell on, most especially on vaccine hesitancy. There has been a lot of circulation of news and misleading news on social media, on all over. People are saying that the vaccines are not real. So we have a lot of work to do on our hands. And that is to tell you that it is not actually by mistake for us joining the Geneva Learning Foundation, which had actually prepared us with various panelists and peers who came in, and professionals from Gavi, WHO, and UNICEF, and all others who had supported us, and even the university researchers who came in to prepare us for the upcoming and hesitancy and issues that had actually been developing us. So I am equally happy that I came in here as one, and I'm prepared to give my part in how to gain confidence, on how to make people accept based on hesitancy, and how to make sure that people readily, without hesitation, collect vaccine, and how to hold, or how to accept, and how to support the national in how vaccine could have equitable vaccine distribution, and how to make people accept vaccine in our own country. I think virtually, let me just give room for others to equally participate. And this is just my part. A rather happy New Year to you. Happy New Year to all. And I sincerely want to wish everyone a very prosperous year. We are looking for 26 through when we will start the teach read properly. Thank you very much. I'm outside.
Thank you so much, Emmanuel, and happy warm wishes for 2021 as well. Thank you for sharing your thoughts and comments as we kick off the new year. Last year may have been the year of the pandemic. I'm hoping personally that this year will be the year of the COVID-19 vaccine, and that places everyone in this room, everyone on this live stream who works in immunization, makes what you do more relevant than ever. Georgios Milios, you've had your hand raised for a while. We would love to hear from you. Please go ahead.
Hello, Reda. Hi. Happy New Year to everybody. Hello to all the participants. For my part, what a year 2020 was an amazing year for everyone. It proved and showed us how many we have to learn and in order to be really prepared for a pandemic. Every system, no matter how advanced, had been in a totally critical situation. We've seen systems that we never expected to be put on their knees. They went on knees, and it was a year of learning for everybody. Unfortunately, in the hard and a harsh way. From my part, from what I've been learning all this time with you, with the Geneva Learning Foundation, was an amazing boost for helping me to gain new ideas and perform practices that I never thought it would be possible in my country. I totally forgot to present myself. I'm from Greece, and unfortunately, I'm the only participant from my country, so I have to push myself always forward. I envy in a good way all these hundreds of participants from Nigeria, for example. They're giving one another support, and okay, it's quite hard when you're alone. Anyways, it is amazing that the lack of confidence, it's a thing that we find in for the new vaccine. That's what I mean. It's something that we find commonly in every continent, in every place that I was seeing. A lot of people have the same fear of the new vaccine. The anti-vaccination movement has gained a lot of space due to the new presentation of the drug. That it was the only thing that we had in our arsenal for giving our hopes on the drug. And I really have seen that due to the whole idea of the new pandemic.
I think we just lost Georgios, unfortunately. Let me see if we can get him back. Nope, it looks like he's gone. Okay, so it happens to everyone to lose a connection. Let me... all right, maybe he will come back, I hope. Let me just quickly address a few of the questions about presumably the vaccine hesitancy exercise. So there's one person, Leonard, who wants to know why some people have not received certificates. So, dear Leonard, no one has received their certificate yet. As explained, we'll be holding a commencement ceremony to award certificates at the Teach to Reach conference. So that will be part of the conference. You'll have to wait and be patient until then. Ali wants to know about changing certificate names. So there's a procedure for that. As long as you follow the process and do it within the deadline, we can adapt, correct the name on your certificate, which should be the same name that's in your passport for obvious reasons. Then I think there was one more question about certificates. No, that's it. All right. So let's hear from Nasiru Shuaibu. Nasiru, the floor is yours. I'm asking you to unmute. And we would love to hear from you, your reflections, New Year's wishes. If there are other people who want to share their good wishes for the new year. Nasiru, welcome. Yes, the floor is yours.
Yeah, I'm Nasiru Shuaibu, colleague from Dara, from Bauchi State, Nigeria. I'd just like to just have a little bit question and more elaboration based on what things have been going on in my field, based on how the COVID-19 affects my activity, usually immunization, the challenges we are really facing, and how this learning Teach to Reach helps me in order to boost and improve the way I can build confidence to my people to accept the activity of immunization. Actually, more especially in the issue of this COVID-19, there is a lack of confidence, as the earlier someone have been just saying, based on the people of the community are trying to talk the way this vaccine is being created or is being produced and how confident it is. So many rumors about these vaccines. Hearsay is just going around everywhere. But we are trying to do a lot of things based on our field to see how we can build confidence to the people to accept this vaccine. What I'm trying to find out, I just want to ask whether if there anything possible that could be done which will improve the social mobilization activities, even when this vaccine is going to be introduced to the people or to the whole world. There must be a very intensive plan on the issue of community mobilization that will really help in disseminating information, creating awareness, building confidence with the community. And there must be a lot of challenges that we're gonna face actually, but we need to bear with that, and we need to do a lot of planning. So thank you very much. That's just what I want to just contribute, and have a nice day.
Thank you so much, Nasiru. And I know that at NERIC and then in the different states, both at the national and subnational levels in Nigeria, preparations are underway for COVID-19 vaccine introduction. There may be other members of the Nigeria team who can fill you in, and as well as to what the challenges are. That is the point of or one of the points, hopefully one of the strengths of the COVID-19 Peer Hub is to really support you in connecting with your colleagues in your country as well as from other countries. I see some great comments. I saw Sahini posted her comment on both LinkedIn and Facebook. I think there's a few very digitally talented and savvy, more than a few in the peer hub. So Sohini says the hope, the belief that 2021 will be a year of health is what is felt strongly by everyone. This is the right time to draw focus to not just the COVID vaccine, but to immunization in totality as one of the biggest health interventions globally. I think the Teach to Reach Accelerator Conference will not only help in sharing capacity building strategies, but will also help bring together professionals who will help in pivoting masses towards immunization practices. I did that mean to set off the applause, but hey, it's certainly well-deserved. Thank you, Sohini, for that comment. We also have, let's see, a more practical, very practical question. Mohammed Noor wants to have the course outline of the conference. So I've been showing off and on. This is the course, the conference announcements. It is really about learning by doing, learning by sharing experience, learning by sharing experience with peers, with global experts. The actual program will be published very soon. Register for the conference to make sure, one, that you have your seats. There's a limited number, so you want to secure your seat as soon as possible. Share, just click on the little WhatsApp button here, and you can share with your colleagues on WhatsApp. Don't share with anybody. Share with people who you feel can really actually contribute to making the conference a better event. We're now at D-22. So we're 22 days away from the Teach to Reach conference. If you haven't registered yet, that's the main message. Is already a very large number of people. One of the things, but it's not the only one that's going to make this event really unique is really the number of people who are participating. We already have on the anglophone side 1,350 people this morning who had registered. There is room, there is capacity for more, and you'll be meeting in small groups. There'll be many, many workshops depending on all the topics that you might be interested in, but you need to register now. Otherwise, you might miss out on this really unique opportunity. It is over 3 days. That does not mean you have to block off 3 days. You'll be able to pick and choose which sessions you want to attend once the full program is available. But you do want to make sure you've set aside the time, talk to your hierarchical superior, your boss or your line manager, make sure that you'll be allowed to attend this conference and so on. Nitin Srivastava says, hello everyone, wishing you all a very happy and prosperous new year. And then Abubakar Bungudu wants to know, how and when do you plan for demand creation for COVID-19 vaccine, and how long it will take to sensitize and mobilize people to accept the vaccine? So this was the number one concern expressed in the Pulse survey that is still ongoing. So Abubakar, we'd love to have you share this, complete this Pulse survey if you haven't already. Let me know in the comments on Facebook if you have. And then I'd like to encourage you, if you'd like to know how Gavi is approaching this issue of demand promotion for COVID-19 vaccines, and just in general, Susan McKay is really the person who's leading on that topic at Gavi. So we did a workshop with her, which you can find on the same Facebook page. COVID-19 vaccine introduction. Anne Lindstrand is a doctor who is tasked by WHO to lead the effort, the global effort for countries to support countries in getting ready. And then you'll also find this workshop with Heidi Larson. So many resources available. I see Damu Gabogo has a hand up. So let's go to Damu and let's hear from Damu. Damu, are you able to speak to us? We'd love to hear from you. All right, let's give. And if there are others who'd like to share their good wishes for the new year, share their reflections on the first year of the pandemic, how you're thinking about this. So Marufu Raimi, I've also activated your microphone. You just need to unmute to be able to speak to us. If there are others, yes, Marufu, go ahead. The floor is yours.
Hello, good day to every one of you and Happy New Year. I don't know, are you hearing me?
Yes, loud and clear. Tell us where you're connecting from, please.
Oh, I'm connecting from Nigeria, Bayelsa State, to be precise. At least I'm happy seeing one of my boss online, Dr. Ifikapaye Okoye. Is the person I actually report to under the immunization session. However, the 2020 has been a challenging year for every one of us globally around the world. Even up to now, the effect is still there. However, I must say the COVID-19 hub, well, to me, is a family, and it has actually widened my horizon, particularly when dealing with indigenous people within their local milieu regarding immunization activity and how to address some of those challenges. So for me, as a person, I must say a very big thank you to COVID-19 Peer Up. You have actually get me informed beyond my knowledge before I actually started the training per se. Be that as it may, I still want to, in addition, I still want to say that the COVID-19 has actually, brought our life online, because I must tell you, 90% of my activity is actually based online. If not for the COVID-19, I don't think it would have been that way. So in summary, I want to say a very big thank you to the family, and let us keep the issue on. But in specific, I want to say there's a lot of fake news, fake information going around surrounding the issue of COVID-19 and what have you. And I've also received a lot of mail regarding COVID-19 vaccine efficacy, particularly in developing countries, which Nigeria is also one of them. And some institutions have also written to me to also come up with a research in that regard, which is something we have come up with a team to start looking at, because the rate at which this fake news is circulating, it calls for concern. And I believe this platform will be a fantastic platform to actually douse that fake tension that is going around, the social media about the issue of COVID-19. It is fake. It is trying to depopulate the developing country and so many others. So this will be a good platform for us to put the record straight and to make people well informed, so that they can actually take an informed decision going forward, moving forward, and not particularly for individuals, even for government, for advocacy, for policy information, and the rest of them. So I want to thank the whole family, the whole household, for the good work we have all put together for quite some time, particularly within year 2020. So I want to say top up to the group. Thank you so much, and God bless you all.
Thank you so much, Marufu Raimi. I'm showing on screen the COVID-19 Peer Hub Pulse survey. Have you completed that? It's very important that you share these concerns that you have about vaccine hesitancy. Marufu, have you been able to complete?
Yes, I have done that, and I also got a notification to that effect. In fact, as a matter of fact, I think I did that. Is it thrice? If I'm not mistaken, it was the third time I got a notification.
All right, you only need to do it once.
And I have also shared it within the immunization group. Particularly, wonderful. Yes, I also put it, and I also encourage some of my senior colleagues to actually make input.
Okay, thank you so much. And so again, the reason we're asking you to complete this pulse survey is to help us understand your needs and challenges. That's not just me, but that's also the partners that we worked with. So some of the questions that you found in taking the pulse survey were prepared with input from the World Health Organization's immunization data team. They will be looking at what you tell us. And the difficulty is, yes, there are a large number of respondents from Nigeria, but if there isn't a critical mass to really build a picture of what is going on countrywide, then we may not be able to use the results at all. So we're really asking and looking to you for support to make sure that the word gets out about this survey, and that your colleagues who are going to be busy, are going to be just starting out the year, we've extended the deadline until this Sunday. So if you haven't already, and I know so many of you have, if you're here in the Zoom room especially, or online, you probably have already shared, just go to the Peer Hub page. It's COVID Pulse. You can see here. and click on the WhatsApp button if you want to use that. But you have many other options to share. So that's just that's a reminder about the importance, the significance of the COVID pulse. And in fact, all roads lead to Teach to Reach. That also means that the results of the pulse survey will be presented for the first time at the Teach to Reach conference, 26th, 27th, 28th of January. Again, participants will be able to pick and choose which sessions you want to attend. You don't have to block off all 3 days, but you will gain a lot the more time you spend at the conference in a number of ways. Damu Gabogo, I saw you unmuted yourself briefly. Are you able to speak to us now? Okay, and I see many other hands raised. So let's go to Adefunke Adesina. Are you able to speak to us, Adefunke?
Good afternoon. Good afternoon, Mr. I'm Dr. Adefunke Adesina. I'm connecting from Lagos, Nigeria. I would like to say that COVID-19, just like every other people in the platform have been saying, had actually been a challenging in year 2020. Because of can I put it as an unexpected outbreak as it is. And up to now, we're still having impact in terms of economic, in terms of all aspects, all areas of life, especially the most important part, which is the health of the citizenry. Yeah, and by and large, we know how important it is in the, especially the immunization aspects of especially the infant immunization, how the healthcare worker was scared initially to come to the facility and to actually give people their immunization. But from this platform, we'll be able to do a lot of things, shared experience, challenges from all parts of the world, how people will be able to cope and to revert the existence of vaccine by the populace, as in the reduction in the demand during this hectic pandemic. The platform are so encouraging, are so echoing in such a way that we share the challenges from all other parts of the world, how they were able to solve one or two problems, and we have actually equally shared ours. Concerning the pulse, I've taken my pulse and answer all the necessary questions, and I am looking forward to participate actively in the conference, to contribute and to share my experience of what I've gained by made use of my plan. I was actually part of the first set of the pair up for the COVID for the immunization program during the COVID pandemic. We've shared, so I'm looking forward to participate actively in the conference and to share my experience as well. Those ones that we'll be able to do and that we'll be able to improve in some of our activities, despite the effects of COVID-19. Thank you.
Thank you very much indeed, Adefunke Adesina, and Happy New Year to you. Hope this will be, as Sahini said, a year of health. Now, in addition to the International Advisory Board, composed of most, if not all, of the global partners that you can see here, the Teach to Reach conference is actually being led in many ways and thought through. And we had many meetings in last year ahead of the conference. You can see a very large number of people. There's 282 members of the organizing committee. Now, you may recognize some of the names as fellow scholars, but we did not go to the national leadership of the country, to the EPI team, and say, can you help us figure out who's responsible for training? The way people got on this list was really through the effort they put into the Teach to Reach program. 2 levels of certification, very rigorous, very demanding, and then the second level focusing on leadership. And you can find, it's at the bottom of the Teach to Reach page. Find out who is actually helping to organize this conference. And of course, they are now, in many countries, They have presented the Teach to Reach conference to their national EPI manager and to the national team, wherever they may sit. And this is part of the conviction about what we want to do and how we want to do it is also important with this conference. So everything here is being community-driven, co-designed, and rather than talk to you about that, I'd like to give you an example that comes from Ghana. So on the Telegram group of the organizing committee, this video was posted, and initially we were like, what is this? And then we realized it's a member of the Teach to Reach organizing committee that is actually speaking to hospital staff in his district, health facility, region. I'm not sure which one. We're trying to get the details. He hasn't told us yet, but I thought it'd be more interesting to hear this video to show you how people on the ground are actually taking this forward, and how we're hoping to bring many more people.
Reaching is that a lot of people, and in fact, the second hit is coming, and it's even very hard. From the international front, there are a lot of people dying. Doctors are dying, nurses are dying, just because of the virus. Now, the different strain that is coming on is so deadly that when it gets you, you are just going. So, in view of this, there's going to be an international conference, and by Geneva Learning Foundation, it is such an international conference that almost about 95 countries are involved in this conference, and it's for health workers. Whether you are a nurse, a doctor, you are at the lab, anywhere at the stores. Now, this kind of conference is going to help you know how to train other people if you are involved in any kind of training in the vaccine introduction in Ghana here. Now, what is going on now is that the vaccine introduction in Africa, there is sort of hesitancy going on now, just because of this race. But when you enroll in this international conference, there are certain things that you will know out of it. The WHO representatives are there. Other kind of information that will help us know much about this immunization, you are going to know. So the flyer has been, like, it will be put on the hospital's page. So you just get the website, dial it onto your browser, and you just register. When you register, they will ask you certain questions. It is very simple. You register and you are going to meet a lot of professionals. In fact, if I say professionals, a lot of professionals, and you are going to learn a lot. The conference is next year, 26th to 28th of January. So I entreat each and every one of us as health workers to be part, and we are going to learn how to train our staff. We are going to learn how to give sort of addition whenever you are being touched to help in the COVID-19 vaccine introduction. So this is just a way of information. Let us get updated on the hospital page. Thank you. Thank you very much.
There you go. That's a member of the organizing committee in Ghana doing the work with working with colleagues, working with peers. I believe it's in a hospital setting. If our Ghanaian colleague is here, I would love to hear from him so he could tell us more about it. Let's go to Mohammed Chaudhry. I hope I'm not mispronouncing that. Mohammed, please, the floor is yours.
Hello.
Yes,
Can you
Mohammed.
hear me, please?
Yes, and before you take the floor, let me just challenge a little bit. Members of the organizing committee from other countries, you saw what our Ghanaian colleague did so powerfully. We're not sure who, it's other health staff, so it's colleagues that he was addressing, and just inviting them, sharing the invitation until you get done. So that is how it works. More than 2,455 people have registered so far. We still have seats. Just make sure that you do not delay in terms of getting to getting to the registration for this conference. We're counting down. We're at D-22. So in 22 days, this conference over 3 days will kick off on the 26th of January. I think we have reached, I see no more hands raised. If there are any other scholars in the room who'd like to share their good wishes for the new year, share their reflections. Okay, I see Mamfo Maferika. Go ahead, Mamfo. The floor is yours.
Hi, everyone. The members of the PA Hub, I'm very glad to meet you again. And this year, we are hoping to work very, very hard. And also for the introduction of the new vaccine, I hope we are going to work well, especially here in Lesotho. We are going to introduce this new vaccine. I'm very glad to be with you. But I have my question. Can I have a question?
Of course.
Okay, yes. I just wanted to hear about this conference that is going to be on the 26th. And is it going to, how many hours are we going to spend in those days? How long does it is?
Very good question. So the 3 days will be split between French and English. And so we're still finalizing, working on the program actively now. It's really going to depend on how many inputs we get, how many proposals for sessions and so on we get. And, but basically thinking that it'll be 2 to 3 hours per day in each language. So a little bit less than half a day each time. Again, we're talking about a fully digital conference. We will not be using Zoom. We'll be using a dedicated platform specifically for conferences that has some neat features. I know some of you have tested this conference platform. And it will enable all kinds of things. So there's a plenary room, there's rooms for workshops, and we'll be sharing, of course, the full program so you can pick and choose and say, okay, this is actually relevant, this will help me in my work. This I'm interested in because I'm thinking about my career advancement. This I'm interested in because I'm just curious and I want to know what it's about. So if you're not a cold chain specialist, maybe, and again, once again, the focus is on how we learn to do things. So the sessions on cold chain will be around training and leadership and looking at how cold chains are going to be adjusted. What somebody who works on in the refrigerators in the national EPI team, keeping the current vaccines cold, if his or her country uses the vaccine, chooses to introduce a vaccine that requires freezing conditions, what is the teaching and learning that is going to have to happen in addition to the adjustments in infrastructure? So you'll be able to pick and choose, but I would say 2 to 3 hours a day is what you should ask for. And certainly if you're negotiating with your boss or with your employer, basically half a day sounds about right. There'll be many opportunities as well for networking. So really opportunities to connect with people who are also in the conference. And what's neat is it's like a remote coffee. You press on a button and you get randomly matched with somebody else in the conference. And so if you have a specific interest, you can say, well, I'm especially interested in meeting people who work on cold chain or who have already introduced new vaccines. And then you click the button and you can do a quick chat video if you have the bandwidth. Otherwise, you do an audio call. And if you both decide to swap contact details, then you can share your contact details. So there'll be some neat features like that, as well as booths where you'll be able to actually just sort of walk around the digital space. This is all online. You'll be able to walk around and stop. Okay, here, I'd like to learn more about what this organization is doing, just like a physical world conference that I'm sure you're all familiar with. So that's a bit of a long answer, Mamfo. Have I answered your question? I hope I have. All right. Yeah, I think you're still muted. We said I hoped that we could do this in half an hour. I want to acknowledge Blessing Okezie, who sends her greetings from Nigeria. Please let us know what city as well as the country you're from, if you're comfortable doing so. That's it for today, but this is far from the end. One of the really important things I haven't mentioned is that once you register for the conference, you actually get invited to start, to propose a session. So you can not only come and join and listen and contribute in various, you can actually propose to host a session, to lead a session, a workshop on the topic of your choice that is important to you. I'm going to show you how you can do that and show you, and once you register, you will pay attention to the acknowledgement of receipt that you get, because it includes the link that you'll need to propose a session. So let me show you that very quickly. So here it's another form to fill out. And this is where the organizing committee of the Teach to Reach conference is really going to come and play an important role. It's one of the times, because the organizing committee will be reviewing the proposals for sessions. Now, we've received some suggestions, some people who say, well, I want to do a session on COVID-19. Okay, it's certainly relevant, but it's a little vague or a little bit too large a topic. So remember, Teach to Reach is about improving immunization training, leadership for learning and teaching, how we learn, how we change, how we lead. And then the more detailed and specific, if you say, I want to do something for people who work at the district level in Nigeria, who focus and to look at how they're going to have to prepare for vaccine hesitancy and how we can organize training around that, then that's a topic. That's just one example of a topic, but I'm trying to scroll down here. So beyond, of course, you have to fill in your details. Let me see if I can get rid of this. I think I can't. Okay, so let me try to do this another way. Here, what is your last name? So we ask you for all of this information. And here are the options for the types of sessions that you can propose. And then you have to decide which track your proposal fits into. Are any of these on hot topics? And then we ask you for a short, compelling title. So this is what, if your proposal is accepted, this is what we'll actually show in the program. The purpose, we want it to be clear what the outcomes are as well. Give us a link. So for somebody who wants to know more, you want to have to commit to submitting a summary and then announcing and sharing the invitation. How are you going to help do that so that people actually show up for your session? Anything else we need to know? So we hope that keeps it simple, and we hope this session has helped to really make it crystal clear what Teach to Reach is going to be about. Also wrap up the loose ends on certification. I saw a question about the limitation on the duration of certificates. So that will not be the case for the Peer Hub exercise, which is certifying that you completed the exercise. If you have any other questions, you know where to find us. We'll be doing more live streams like this in the run-up to the conference. In fact, we'll be having several of the guests and presenters. We'll be inviting them to live streams like this, but much shorter, like 5, 10, or 15 minutes. We won't necessarily be announcing them all, but if you keep an eye on our social media platforms, you should be able to find us. So that's it for this session. We actually thought we wouldn't have a general assembly of the Peer Hub, and this is a bit different. It's really about kicking off the year, just letting you know that we're hard at work to try to build something that brings you a quality experience that you can be a part of, that you can contribute to. And there's in fact 282 scholars who are working, as you saw with our colleague from Ghana, but many, many others who are working to make this conference a success. Some of them need help to connect to the national team, to their EPI managers, to sort out the sort of hierarchical issues in their countries. If you can help, please reach out to them. They're connecting to the country teams that were activated for the Peer Hub, as well as to the team leaders and COVID-19 focal points. I think that's it. We need it definitely. I'd like to ask you one final time today in this session to bring together your hands for a big round of applause. Thank you so much. Happy New Year. Best wishes. We hope this is going to be not the year of the pandemic, not year 2 of the pandemic, but the year that immunization staff all over the world actually succeed in the what we're calling the ultimate Teach to Reach challenge, which is successfully introduce COVID-19 vaccine. If you have any questions, check out the information on the learning.foundation page. And now we're going to do what I actually enjoy, is just doing a kind of quick rewind of the messages we received throughout this live. Again, this time, and this is actually a nice problem to have, there's simply too many messages, so I'm going to do a selection, but here we go. Warm wishes to you all. Look forward to all of the things we haven't announced, what we're going to be offering this year with respect to courses and new programs. We have a lot happening, not only on immunization, but also on neglected tropical diseases, on non-communicable diseases, on radiation, on communication, and so on. So stay tuned for more. Take care. It's been an incredible effort in many countries from the organizing committee to get the word out. I want to commend and thank them